Are you a man afraid of the dentist? Let me tell you, you're not in the minority, but you are in the majority. And I will explain. I'm Dr. Luis Sanchez from Miami Dental Sedation Spa, and I have been doing sedation dentistry for close to 20 years. I play around with my patients and I tell them that thank God that the females are the ones that give birth, because if it was up to us, it would have been Adam and Eve and that's it. Reality, guys, is I've seen it in hundreds of patients that I've had to sedate, that the majority of the patients I sedate are men. It's very common in a family that the first person that I see from the family is the mother, not the father. It's kind of like, honey, you go first and you try it out. See if the doctor is good. But that's not the reality. Reality is that we're so-so with the doctors. So we send the wives first. I have lots of stories of men and sedation. A couple of them come to mind. Some years back, this guy, without making an appointment, he just showed up to the office, kind of probably opened the door a little bit, looked inside, and there was somebody sitting in the lobby inside, and they says, coming in. So another patient was actually the one that invited this guy to come in and to see. And that was the introduction to the office. He actually went in and wanted to see what it was like, what it looked like. Some years back, so he became a patient and everything was really, really good. Funny thing is that his brother, some years back, finally went to the office. And this guy, he wouldn't sit down in the chair to take the x-rays, to do anything. He wouldn't sit down. He spent like 10 minutes in the room, but he was pacing back and forth, back and forth, back and forth, back and forth, and he wouldn't sit down. He was able to sit down, we did the x-rays, we did the work that needed to be done, but that, you know, it's been some years, but it's I have it in memory. I have patients, I have guys that they're full of tattoos and they have no problems getting tattoos, but they're sitting in the chairs like something else. I have men in their cops, police officers. I could think of one and of several, and they sit down in my chair and they're like, I don't mind getting shot at, but sitting here, it's completely different. Those are, you know, it's very common. It is. We are the majority. We have something with doctors, not only with dentists, but with doctors in general. If you're one of those men that is like, you might want to call it fear, or you might not want it to call fear because you're like, you're pride. You cannot get to that point of saying that you have fear or something. Even though my patients do say that they're afraid of the dentist, it's gonna be hard. That first call is gonna be very hard. It's gonna be also very hard to show up to the office. The only thing that I can promise you is that 99% of the times, you're not gonna be my worst case. Patients come in and they're like, man, I'm gonna be Dr. Sanchez's worst patient. I'm gonna be in such a bad shape. 99% of the times you're not. There's somebody else that is being worse. I can promise you that I'm gonna listen to you. I'm gonna try to help you the best that I can to get your mouth healthy. I'm pretty sure I'm able to overcome that fear. That fear that comes from a history. Most of the time is something that happened as a child. That's very, very common, okay? But nowadays with sedation dentistry, you can take care of your mouth, which at the same time, you're taking care of your overall health.